This is your girl Pam.
Hi everyone, it's Uju.
Welcome, welcome, welcome. We have missed you guys quite a lot actually. I know. So today we have a wonderful guest with us.
We do
I'm so
indeed.
excited.
I know, I
I'm really
know.
I'm really excited because this person on a normal day does not come out for anybody.
As in,
They pay for her time,
do you understand?
but she made the effort
Ah, as in, we are
for
special.
this. In fact,
Okay.
I feel very, 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 very special. Very
I
honored
don't have
actually.
your money. So thank you for accepting our invitation to
Honestly,
come
we're
on our
honored.
podcast. Thank you so much.
Pleasure.
So we've got Dr. Winfrey in the house.
Woohoo!
Woohoo! And today's topic is one that I'm sure is going to be very interesting. We have a lot to talk about, and I don't know whether we can unpack it in the time, but we'll try really hard to get through as many questions because we have plenty questions.
It's okay. We'll be all
And
right.
I couldn't think of anyone else really that can help us navigate some of these questions that we've been asking ourselves.
100%.
So, yeah, thank you for coming,
It's my
Dr. Winfei.
it's my absolute pleasure.
Yay.
Awesome. So before we get into it, can you tell the Rooted Connections audience who you are?
My name is Nwife Akhator-Eneka. I'm a consultant child and adolescent psychiatrist.
Woo!
Awesome. So we have our usual tradition on
Mhm.
here where we have a question that we use to, break the ice, and we're going to
Yeah.
talk about that. So Pam, what's our question today?
Okay, so you people like deep questions. So this one is deep, but I'll ask it. So describe a belief you still hold tight, even if someone showed you evidence to the contrary.
I agree with you. That's a very deep question.
So when I saw it, I'm like,
However,
okay.
however, that belief, it's the absolute conviction
Yeah,
in the perfection of God.
yeah,
Wow.
I'm not one who will say, life no balance. Life is not fair. Because the person who governs this creation is God.
wow,
Mm,
So we can't think about him as as a corruptible judge, as one who will do mini, miny, mo. Your life will be good. You will suffer. I
mm,
don't believe in that. So any
mm,
experience I'm going through in life, and believe me, I've been through a bit.
mm,
Any experience I'm going through in life, I ask myself, or I know I have the full conviction that I'm going through it for a specific reason.
wow,
And I ask myself to learn the requisite lessons so that that experience will not waste and so it will not happen again. Because if I don't learn the lessons and grow,
mm,
the experience might come back again.
wow.
So I won't wallow in misery, saying, "Oh, why me?" No, it's happening for if it's happened, it's happened for a reason. So that's it.
wow.
That's deep. Oh. In fact, the answer is deeper than the question. But yeah, thank you so much for that. And to be honest, I don't think I can add anything else to what you said, because we go through so much in our life that in the moment it just feels like, why me? I know
Mm-hmm.
many of us have, I have. I'm not going to lie, where certain things are happening in my life, and I'm like, why? I feel, you feel singled out. You feel like, of everybody in the world, why is it me that I have to be going through this right now? But I think the key thing that you said for me is the lesson. So
Yeah.
I think we tend to miss that because we're concentrating on the thing that we're going through rather than what is it I have to learn through this process. I think one of the things that comes to mind, which a lot of us struggle with as well, is loss grief. Because especially let me when you lose a dear person to you, in that moment, that pain is just something you can't fathom, you can't describe because you never get to see that person again. But I think that there's a lesson in everything that we go through. There has to be a
Mm,
reason why. And I always find that there are moments where that lesson, you will know when that thing needs to manifest, you will know. Then you go back, your mind will cast back to that time. You're like, okay, God, this is why I had to go through that process. So yeah, thank you so much for that. That's really good.
And just to add, yeah, because I always say that there's no good or bad experience.
Mm,
An
oh, okay.
experience is an experience because you're supposed to learn something from it. Imagine a life where all your experiences were good, no suffering, everything was positive.
mm,
Would you have any space to reflect? Will you have time to look up and say, "Oh, Father, you know"? you take life for granted. You
Yeah.
won't appreciate
The good.
his goodness.
Yeah, yeah.
So when you have those experiences, they remember, oh, there's someone up there who's looking out for me.
Mm.
When you get through the experiences,
That is true. Because there's something I always say, like when people say we struggle with forgiveness and things like that, I was like, you struggle with something because you don't fully understand the import of what God has done for you. In the sense that if I know God has forgiven me and I understand the full import of the forgiveness and the redemption being a Christian, to afford somebody else that grace, there's a reference point. Do you understand? But if you never have a reference point to your point of what God has done for you, you take all those things for granted.
Yeah.
And that's it's completely also it's a very good mindset to have, to be honest. And when you were saying it, I'm thinking, can I actually live through that everything is for a reason, particularly with loss? That's the one thing that in my head I've always struggled to have that view of there's a purpose. Just because
Yeah.
of the finality of death, and there's some that just don't make sense.
Never. Yeah.
It really doesn't make sense. And I'm thinking, what could the good be in this? But ultimately, as you say, to the people, hopefully, that go through that experience,
Mm-hmm.
maybe one day
It'll make
it
sense.
will make sense.
And
Maybe
it might
one
never.
day.
It might never. But I suppose it's the mindset that whatever it is, whether it makes sense to you at the time, because we never know God's mind. God works in mysterious ways. So it's just the acceptance that it's an experience, and whatever lesson needs to be learned, that we're open-minded to learning it.
that's it. I wasn't singled out. It happened.
Yeah.
Yeah.
Yes.
Yeah. Yeah.
Oh
Thank you.
God, I beg. I don't want to lend it out. Let's just put it out there. Now, God, if you are
We're
listening
not
to us,
ready.
don't those hard lesson. It's not for people like me.
We still want soft life, please.
What's up, life? God, please.
Uh,
All right. So, to our topic for today, we're going to be exploring neurodivergence and how it sort of intercepts with our culture and with faith. You said you're a psychiatrist and you deal with children a lot, so I'm sure you have experience, particularly with you've practiced in Nigeria, so you have people of our cultural, First off, is neurodivergence something that we accept in your experience as Nigerians or as Africans as being a thing? Or does our culture keep fighting against it?
I'll start with my experience as a psychiatrist working in Nigeria. There are a few people I saw who I wasn't quite sure what was wrong with them. And probably misdiagnosed them. It was after I moved here and started working with neurodivergent children, because I worked with adults first,
right.
working with children.
Mm.
So when I started working with neurodivergent people, I was like, wait, that girl I saw that day, this was most likely autism. But we give, so that's in Nigeria, because people don't present to hospital. When I remember my job in child and adolescent mental health in Nigeria, the autistic children I saw were those who were severely autistic. For example, the ones with ADHD were the ones who were severe on the spectrum. The ones who were highly dysfunctional, who couldn't sit down in class, who had, problems that everybody could see.
Mm.
However, coming to this part of the world, you see those on the lower part of the spectrum
Yeah.
who have small issues with social communication, social interaction, have the preoccupations. That's for ASD, and for ADHD, who are inattentive, but they're not that dysfunctional. But because of the awareness, those things are noticed early. So that's the main difference. So in Nigeria, the ones on the lower side of the spectrum don't present services. They're the ones who will go to school and they will call them Olodo,
Yeah.
or they're the ones that they will beat blue and black because they don't hear a word.
Yeah.
So those are the ones that the system will most likely miss in Nigeria, because they know there's a problem, but they just think it's stubbornness.
Yes.
Right.
Yes,
Okay.
that's the key difference.
Okay. And okay, so I think the key question there is, even when a child starts, because I think one of the things that sort of piqued my interest is um being here, moving to this country. Like you say, we cast our mind back to certain children, or friends that you might have even had back then in school, that presented with certain behaviors that we just thought they like things done a particular way. And then if you if you maybe move something, they get really agitated, or people that don't like to share certain things. I think I can remember a couple of people that they had their own cutlery and they were so particular.
Mm-hmm.
They couldn't share.
Mm.
And if you dare touch that cutlery, you are done for.
Mm-hmm.
Do you understand? So back then, it's those little things that we now, looking back and thinking, wow, so that person must have actually been on the spectrum. So the question though is now there's a lot more awareness around these issues, but we're still finding, or I think personally, maybe it's just an assumption, but I think from little experience I've had, where a lot of African, or should I say, let me stick to Nigeria because that's what I know, really struggle to, even when their children are presenting with certain behaviors, they really struggle to accept that there might be something else that needs to be explored. So they don't access service. Do you find that to be true?
Oh, yes, and for a lot of reasons. You know how it is with mental health generally, particularly in Nigeria, the
Mm.
stigma associated with mental health
Yes.
and the denial. Then a lot of fixation on faith, which on one hand is a good thing. However, when it begins to affect your child, then it's not such a good thing. Because when your child is different, most times Nigerians will think, oh, it's a spiritual thing, or we can pray this bad behavior out. They won't think, this is a medical problem
Yeah.
that needs to be explored. So basically, that's the main concern. People overlook it in Nigeria. People don't say it because they're not aware. So that awareness makes a world of difference. When people are now more educated, when they know, okay, there's something wrong with this child, or that child in class who, for example, we are big on academic success in Nigeria.
Yes.
Oh, yeah.
Yes.
That child that child that can never confess, or that child that repeats in primary school. That's like the worst thing you can imagine in Nigeria.
Yeah,
Who
yeah.
repeats in primary school? For some children just couldn't grasp what was being taught in class. And imagine a classroom setting. Think about the Jakonde schools, for example, in Lagos. If you can imagine anything about Jakonde schools.
Yeah.
Oh, yeah.
Okay,
Yeah.
so that level where they had like 60 to 100 in a class with one
Class, yeah.
teacher.
Mm.
Imagine having one or two children who have ADHD in that type of class. Of course, that child will just follow between the gaps. Unlike here, that where they have teaching assistants, there's one-to-one support. So being in that setting, it will be a struggle.
Yeah.
And because the teacher is teaching, the person's mind is not there.
Of course.
Or for those who have ADHD with impulsivity, those children who they will say, wait your turn. Don't raise your hand yet. But they can't control themselves because people don't understand the medical underpinnings under these things. They just think it's behavior, not a medical problem.
Mm.
So that's fundamentally one of the things we suffer in Nigeria. So awareness makes a world of difference. So academic success, then the defiance. So children are really defiant. Think about
Yeah.
it.
Yeah.
Even here, people struggle with the defiant. People hear that there's awareness. It's not about Nigeria. Those children that send them to school, they're scaling fence, so they're outside. You know,
God.
and they beat them. But despite the beating,
Yeah.
It doesn't change anything.
it doesn't
Yeah.
change. And if it changes, it doesn't change anything. There's no positive outcome to the
Positive.
beating.
I was just about
At
to say
most,
that.
they will internalize it, feel as if there's something wrong with
They
them.
have to
It will
suppress.
suppress it, to affect their self-esteem, probably will lead to other mental health problems. So that's some of the
Okay.
issues.
Okay, so let's tackle ADHD now. So let's first of all, can we just define ADHD properly for those who might not really understand what it is? And then what is the difference, or where is the line between just a hyper child or a hyper person and somebody who actually has a diagnosable condition with ADHD? Essentially, what I'm also trying to get at here is maybe what are the things that parents need to have as a trigger to know that, okay, I need to see somebody about this child. This is not just my child being hyper. There is something that I need support with here.
First of all, for all mental health diagnosis, for example, we're strictly guided by diagnostic manuals. And because if you've noticed, some people say, maybe someone that likes washing their hand will say, I have OCD. Or someone that's, that can't sit still will say, I have
Yeah,
ADHD.
yeah,
So lots of times we use this psychiatric these terms loosely.
100%.
So for you to say someone has a disorder, think about it. What is a disorder?
something that isn't right.
Lack of order.
Yeah, yeah, yeah.
Yes.
Yeah.
So some people have hyperactivity. Some people, so coming to the definition of ADHD, so it's attention deficit hyperactivity disorder. So it's children who, so it's a neurodevelopmental condition. It's usually there from when children are 5, sometimes not identified,
Yeah.
but should be there. So, because when you're doing an assessment, even in adults, you want to find out if these symptoms were there when they were children.
Mm-hmm.
So it's there when they're
Yeah.
developing. So issues with attention, hyperactivity,
Mm-hmm.
and impulsivity. And to make a diagnosis, these things should be glaring and
Yeah.
in 2 different settings, at home and in school.
Okay.
Okay.
So if it's only at home and not in school, think about what's the behavior. How are parents managing this child at home? Are there issues with boundaries? Are there things you're not doing as a parent that's making this child unmanageable?
Mm-hmm.
For example.
Okay.
So
Okay.
basically, yes, so that is what ADHD is
Mm-hmm.
largely. So attention deficit hyperactivity and impulsivity.
Mm-hmm.
It should be there for at least 6 months. And most importantly, there should be a disorder. Remember, dysfunctional.
Dysfunctional.
Should affecting the person's ability to function in school,
Mm-hmm.
and for adults at home, those ones that have frequent accidents, those ones that can't keep a job. So for when you do an everyday assessment, you have to explore how much of the person's functioning is affected.
Right.
Right.
So you
Right.
can't say someone has a disorder if person's life is in order. Does that make sense?
Yeah. 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 Yeah.
Yeah.
Like I
Yeah.
said, it's everything's on the spectrum. I'm very fidgety. I'm very hyperactive. Like you notice stuff, but you can't just label me ADHD because it's not
Yeah.
really affecting my life.
Yeah.
So everything, all of us are on the spectrum somewhere. Of all the mental disorders, all of us are on the spectrum, on one part of the spectrum. So those ones that the symptoms are significantly affecting their lives,
Right.
then you can now say, oh, this
So
person
the
has
inability to function.
to function.
Right. Right.
Yes.
Right.
Right.
So I think so as a parent then looking at a child, so if my child is generally okay in the sense that they're able to, yeah, they're very hyper, but when should I say they're stimulated right or they're engaged right, they behave properly. I shouldn't be too worried in that sense of trying to get a diagnosis because a lot of people worry about their children. Oh, this child is too hyper, this child can't concentrate, but in school, to your point, maybe because the child is able to follow the lesson in class,
Mm-hmm.
the teachers are refusing to give sort of the referral to go get the to get an assessment. So it's just, I think the take home for me is if the child is able to function, or the person is able to function to a large extent, you shouldn't be too worried in terms of trying to get a diagnosis because the person is not in total disorder.
Let me add a clause. In some cases, yeah, the distress is more internal.
I see.
So for that child whose thoughts are always racing, whose
Mm,
thoughts, so some people are very highly functional. Some people are able to mask it. Some people are able to. There's schools that have staff that's so well trained that they're able to manage these things well. That's for ADHD. For those who are autistic, many of them have learned to mask those symptoms and have learned to cope in the school environment, for example.
right.
But for some people, they realize they're just different. Why is that my thoughts are always all over the place? Why is that things are not quiet in my head?
Mm,
So some people might need that diagnosis if they want to understand why they're different from other people. So if you have a child who's distressed by it, so not only dysfunction, but the distress that comes with it.
yeah.
Child who is distressed, why am I different? Why is that I can't sleep at night? Why is that my thoughts always racing? Why is that things are never calm inside here? Then it might help to okay, let's do an assessment. However, not every child, or not everybody that has ADHD needs to be medicated.
Right.
So for some, right, to those who are functioning okay in school, then we can, because first line isn't medication.
Yeah.
It is okay, behavioral modification.
Management.
What can you do to change? What can you change in the home? What can you change in the school to help this child cope better in those environments? So
Okay.
that's
Okay. So my follow-up question to that then is: are there times where, even though there might be some truth, like you said, we're all on a spectrum, are there times where getting a diagnosis can actually cause more harm to a child than get if the child is, so maybe as a parent who has seen that their child is different somewhat, but like you said, the child is managed very well at home, and parents understand the cues, but they haven't actually been told, okay, this child has, you know, ADHD or ASD, but you're just curious because the child does not, maybe for some children is labels, they get really upset because the label of their top is, it just irritates them,
Mm,
or they don't like certain colors, or but day-to-day life is functional.
mm,
um and they're saying that they're doing well in school, they're thriving. So apart from those little social issues here and there, would you then say that there's no need for that child to get a diagnosis? Or is it actually, if a parent should notice that there is something different, they should seek to get to the bottom of it?
Let me answer the first question you asked about, are there times that, getting a diagnosis comes with some problems?
Yeah.
Yes.
There's something called diagnostic overshadowing, right? Because someone has a particular label, people now stop looking out. If there are other issues, they blame it on that diagnosis. So that can happen where there are other issues that can be sorted. And that's why me as a professional, I try as hard as possible not to medicalize things. Because once you've accepted this is ASD, this ADHD, everybody will just back out. Social services that, sorry, no,
Be careful.
no, I'm thinking, sorry, I'm not trying to yab them. But in some cases where they're supposed to put certain things in place, once there's a label, everybody just, okay, it's ASD, it's ADHD. Then
Mhm.
nobody thinks about doing anything else.
Right.
There's some children I see, and I know potentially it's ADHD there, but I'll hold on because I want the
Other
services
things.
around the child to put certain things in place.
Yeah.
School, social services, parents. Because once you say, oh, this is ADHD or this is ASD, then everybody says, oh, everything is wrong with that child is ADHD. Oh, nobody wants to try to help that child apart from throwing medication at the child. So that can be the downside.
Right.
Then, like you said, if a child is different, a tag is disturbing the child can't wear certain leggings, or the child can't wear shoes. I have some patients that wear Crocs to school, even in winter, because they can't wear shoes. They're
Wow.
that sensitive, right? So it's a problem, isn't it?
Mm.
And as they grow, it can begin to affect their self-esteem if they don't understand why they are the way they are. Why is it that the other children are wearing shoes and I'm wearing Crocs? Why is the other children can wear school uniforms and I can't? Or there's someone likes a particular kind of, like, I have parents who've lamented that they've bought different types of leggings and the children are not able to tolerate any of them. So it would help for the child to know why the child is different.
Right.
Does that make sense?
Right.
Yeah.
Yeah, it does, 100%. I listened to something, it was on the BBC the other day, actually. This is a couple of years ago. And this girl, she got a diagnosis of ADHD. No, it was ASD actually. But she got it at about 15, 16. And she said at first, when, it was suggested to her as at 13 that she could possibly have, or could possibly be on the spectrum, she first of all said no.
Rebuffed it.
She rebuffed it.
Mm.
This is a Caucasian girl, a white girl, so it's not even an African thing. And then eventually, when she got the diagnosis, she said for her it made her life make sense, because she used to force herself to be in situations and settings she didn't like.
Yeah.
So she was socially awkward in the sense that she didn't like gatherings, she didn't enjoy going to parties, she didn't like loud noises. But it's the thing everybody her age was doing. So she used to force herself into those settings. The diagnosis for her then made her settle in herself, like, okay,
Self acceptance.
this is why I don't
Yeah.
like it. So
Yeah.
I don't need to push myself to do it because it's just not me.
Mm-hmm.
So I think that's the positive in getting that diagnosis.
Right.
But if you're able to get that balance between getting a diagnosis and putting a label on yourself.
It's an intricate, that balance, that thing has to be balanced intricately. So you assess the situation. Like, everything is unique, everything is specific to the person, right? It's not, we can't use a blanket statement and say, okay, for all, but you don't give labels. Do you understand? There's no blanket statement. So it's unique to the individual you're seeing in front of you. Like that child, and that's what I was trying to say. Because sometimes they don't know why they're so different.
Yeah.
Why is it that other children can do certain things and I can't? And that thing puts things in perspective for the child. The person says, okay, I have autism. That's probably why I am the way I am, right? And it depends on the social situation around the child, level of support around the child, to both help the child manage the situation better. For the parents who just want to hands off and say, okay, this is the problem, then it becomes a problem, because once it's a label, then they don't put the effort behind, the effort to do what they're supposed to do to help
With
that
that
young
thing.
person. So
Right.
it's balancing things out, so if it is a problem, it's good to know that what the problem is. And that's why I said, as long as you're abiding by the guidelines, then if you see a professional, a person says, oh, for the autism diagnosis, it's like, it's not easy. Because most times it takes multiple professionals to make a diagnosis of autism.
Oh wow.
You, it's rare for you to see one person who will say, oh, it's autism. So when I used to work in the an autism assessment team, it was me, probably the someone from school, and an OT. So three of us will do our separate assessments. Then we'll come for a professionals meeting
Meeting.
and agree or disagree. Because think about these labels. Labels are stuck for life.
Mm.
If you stick a label of autism on someone at 5, that label will be there until the person is 80,
Mm.
right? So you have to be sure that that
Yeah,
person
that's
actually
it.
meets the criteria before you stick that label on the person. So
Right.
there's a really high threshold before you give a diagnosis
Of
Right.
autism.
of autism. And
And
well,
ADHD as
and
well.
ADHD, but ADHD is more obvious with ADHD in some cases.
Yeah.
But before we also give a diagnosis, we have to like give school. School has to give detailed reports of what differences they are seeing in the child. We give assessment diagnostic tools.
Right.
Then, if they meet a criteria, so we give the reports or the tools to the school and allow to the home. And a certain threshold has to be met before you say, okay, this is ADHD.
Right.
So it can either be ADHD, inattention, it can be hyperactivity, impulsivity, or it can be mixed. So it
Oh,
depends. So
right.
not
So
all of,
there's even two different types of ADHD.
yes.
Oh
So the
wow. Okay.
inattention, hyperactive, impulsive, or mixed. So three.
So
Three.
please,
So,
can you give us a bit more insight into those three, how they present, if
so
possible?
the inattentive person is that one in class where the teacher is talking and the person can't focus, can't concentrate. They go to a movie cinema, they want to go to the toilet 50 times because their concentration is not, they just can't
Mm.
focus. Even classes or subjects that they like,
Mm.
but they are there and they're daydreaming. They're not even present. Their
Okay.
mind is somewhere else, as in they're not able to focus on a task. Give them homework. This is what you ask the parents, and they say things like homework is impossible because anything that requires mental effort, they can't focus and do it because
Mhm.
their mind is all over the place. So that's, and those things most times are more obvious in school. And when it comes to, for example, medication, sorry, I'm just sidetracking. We most times give medication for them to focus in school because
Right.
these meds usually have a time span, 8 to 12 hours. And most times they wear off at the end of the school day. So the parents will deal with all the excesses that comes with having a child that has ADHD.
Right.
Because you want to give the child a level playing field with his peers. Imagine a child who has ADHD being in the same class with other children who don't have ADHD,
Yeah.
right?
Yeah.
And the child has the same level of intelligence.
I see. I
Yeah.
see. I see. Yes. Yes.
But because of the ADHD, the child doesn't do as well as the other children.
Mm.
So that's why at that point in time, and especially if you get school reports that show that the child is not doing well,
Mm.
you want at that point in time, then we can consider giving medication
Mm.
so that the
Right.
child can be on the same level as his or her
Yeah.
peers.
To level the
So
Okay.
that's
playing field.
so
Yeah.
the hyperactivity, those ones that just cannot sit still, you see them now. And in our society where people give daggers or the bad eye to
Mm.
children who are being badly behaved in public, so those children that are in the shops
Rolling
can
on the floor.
rolling on the floor, and you say, bad mother. People giving the daggers, but sometimes it's just what it is.
Oh
So
wow.
the hyperactive ones that can't sit still,
Yeah.
they're up and down the stairs, they're climbing fences, they go to the cinema again. Then but one question I like to ask is, how is this child at the dinner table? That's my favorite question. When you go out for dinner, oh, so he's always under the table, or so those ones that are not able to sit down in a formal setting. Then impulsivity bits are those ones that can't wait in line. For example,
Mm-hmm.
you can't wait your turn, and the question is asked. You just raise your, you can't wait. You can't control the impulses. So that's
Right.
that's in a nutshell. But it's a bit broader than that.
Wow. Thank you.
And how does it present in adults? Because I think for a lot of Africans, because it wasn't um a thing for us when we were children, as you alluded to earlier, those children that we labeled when we were in school.
Mm.
So for many people, it's as adults that they are trying to sort of get this diagnosis, understand. So how does like the impulse control, for example, present in an adult?
So in adults, for example, most times the hyperactivity bit is less. But for children that have ADHD, two-thirds of them have the symptoms in adulthood.
Mm,
So what is more glaring is the inattention and impulsivity.
mm,
So in adults, those ones that can't keep a job or at work, those ones that have lost several jobs because they were sacked because they were not able to pay attention and get the job done. Frequent road accidents, people that can't keep marriages because they're not even, it is how marriages, frequent road accident. And another thing that people overlook is substance use. So,
ah,
for example, those who have ADHD who are medicated are less likely to go on to use substances
Who are
right.
medicated.
who are medicated
Right.
because the medication we use are stimulant medications, for example. And this is similar to other street drugs that give that stimulating effects.
Okay.
So some of them notice these differences in themselves. They smoke cannabis and they're like, oh, this thing got me, man. The symptoms are, I'm calmer, things are
Calm
more
me
settled
down.
in my head.
Mm,
So a lot of them go on to self-medicate.
I
So when
see.
ADHD is not treated, the
These are these
risk is
things.
more. They're the ones that will be in the prison settings because they're getting into trouble. They can't control their impulses. They're getting into fights.
Mm,
So yeah, so those are the
that's
things.
how it
That's how
presents.
it presents.
Wow. I think it's the thing you've just touched on now is actually quite key, particularly with substance misuse, because I think it's one of those things that you think, why would you pick up
This habit.
cocaine at age 45 when you already know what it does to people? But I think this kind of gives me a different spin on it, that this is someone whose brain is constantly going,
Hmm.
and they tried this and it gave them a bit of calm, and it's like, and that's the thing that is driving it. And I think for me, I've learned something that maybe now I have to give people a bit more grace because
Um,
you don't understand necessarily why people make certain
Certain
Decisions,
decisions.
yes. I'm not here promoting substance use.
No, 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 no. I'm not saying to do that. I'm just
That's a
saying that is
disclaimer.
one of the
Yeah,
is a coping
it
mechanism
is a
for some
coping
people
mechanism.
that we very often don't give people the grace for, is the
Yes,
point I'm
yes, oh
making.
yes.
Not that we're saying somebody you should take it, but what we're saying is there's something else that is
That's driving
driving
that behavior.
that behavior that
Yeah.
we often don't give people grace for, and you just think, how can your judgment be so poor?
Yes, true, true.
And that's just the point that I
Mm.
was trying to make. Um, there's another thing I wanted us to sort of touch on. I think you touched on it briefly. Is the intersection with faith. And I asked this because I remember being on a group. It's a prayer group, and this lady came on and was asking for advice because her child had been diagnosed with autism. And somebody said to her, it's a spiritual problem. It's of the devil, so you need to go and pray. Now, I'm not in any way disputing the efficacy of prayer, but and that's the approach that a lot of us take. So what's the intersection? You're a woman of faith. So does this the dynamic interplay with your job? And at what points do we say, okay, this is medical, let's face this medically? And at what how much of our faith do we bring to medical conditions like this?
I would say all of our faiths, first of all, because like I tell my patients who are, religious, that the Almighty Father will not come down and heal your child. He'll walk through people.
Mm,
So pray for your child to get the right help. That's where prayer comes in. Because the prayer, I don't want to minimize, the importance of prayer in any way,
yes,
shape, or
yes,
form.
yes.
Prayer is good, oh, but it's when we pray, we say, work and pray. You have to put in the work as you're praying.
Mm,
You can't leave a child who's suffering and you say you're praying. Put in the work and pray that the work you're putting in for that child will come to pass. The people I'm going to meet that will help this child, I will meet the right people to help this child. I will
mm,
meet the right doctors to find out what the problem is and prefer a solution. That's where prayer comes in.
mm.
And that's what I try to tell people who are religious, because you don't want to minimize, because having a child with special needs is not, it's not a walk in the park.
It's not.
And you don't want to minimize that, because being religious gives you hope. It's
Yeah.
that thing that helps you, str- cope with the situation. So
Mhm.
you don't want to minimize it in any way, you know.
Yeah.
So yes, pray, continue to pray, but pray that this child gets the right help. But in a country like Nigeria, for example, where there are significant financial issues, a lot of people are in underserved areas. low income areas, people don't have money. What do they turn to? It's prayer,
Mm.
Abi.
Right.
That's all
Because they
you have.
can't afford to take the child to hospital.
Hmm.
Yeah.
Even half of the doctors have jackpot, including me. So really, it's a problem. So it's a problem. And I remember when I did residency in Yaba, there was a particular church, and kudos to that see what do you call him, the head of the church, general overseer.
Mm.
I used to see the church bus outside our A&E from time to time with the church logo.
Yeah, yeah.
So what they used to do is like all those people that would take their children to church for mental health issues, they would put them in that same church bus and say, take this child to hospital.
Right.
The church driver would drive the child to the A&E, for example.
Wow.
So it's that understanding for the churches to know that a lot of people will lean on them, because when they feel hopeless, they
Hmm.
lean on the church,
Mm.
and for them to also give that support and that advocacy, that awareness at the grassroots level.
Mm.
Okay, this thing is a mental health problem. It can be managed. Continue to pray, but let us seek help through the doctors, through the professionals. So it's that having that knowledge.
That's a
Combining
very.
them.
Thank you very much for that, because what comes to mind is that abuse, that religious abuse. Because I think that as a parent who is desperate, it's such a vulnerable time for you. Do you understand? And some of our core values and core beliefs, it drives us into making decisions that in our minds, that's the best thing I need to do for my child in that moment. So if you have this strong faith and strong belief that why God cannot make my child have autism, because you hear some parents, you can see this child is presenting with these behaviors, and it comes down to, I mean, we've heard stories of children who have been abused, because I work in social services. Children who have been abused, they've had labels as witchcraft, where they've been physically abused, in all kinds of horrible stories you hear. And it's all down to the fact that parents have not gone to seek the right help. Instead, they've put it down to spiritual. This child has witchcraft, or there's some spirits after my child,
Mhm.
and they seek to these pastors or spiritual men and women of God, whatnot, that give them very poor advice. And you're constantly taking that child to these places. And that thing you said about that church, instead of telling the parent that, okay, let's pray, give this offering, you need to do this, because that's the other thing as well. There's
Advantage.
also, the point you're making about, you'll be surprised, you rather pay for
Mhm.
that child to for that you pay a pastor to pray for your child instead of paying for the child to get the right medication. So I think it's really interesting that people just need to be aware that sometimes different doesn't mean bad, because I think that's the issue. For a
Yeah.
lot of us, it's like having that label means that there's something wrong with my child. But actually, God doesn't make mistakes.
Mm.
Yes. Going back to how I started this,
Exactly. Going back, the
going back
perfect
with
will of God.
it's a perfect will of God. Every child is given to the right parent and vice versa.
Wow.
So it's to sit back and say, this child has been given to me. I will tell a story about someone, and I got her permission, before, because I thought about her just before I came in. I
Mm.
actually asked her permission to mention her. And is it okay to mention
Oh
her?
Please
yeah,
go ahead.
absolutely.
She's a woman I worked with in Nigeria. She's a shining example of making the best out of a bad situation, as an apparently bad situation. So she adopted a child with cerebral palsy. Adopted.
Oh, wow.
Wow.
And the child was growing, and the child wasn't achieving the milestones. She went back and she was like, there's a problem here. This child hasn't gained neck control at about, I don't know how many months, but she hadn't gotten even the basic
Mm.
milestones that you expect for children to get early. And they're like, oh, at some point in time, they gave her a diagnosis of cerebral palsy. And I think they said, return this child to where you got the child from. And she said, if I return this child, who will take care of the child?
Wow.
And her daughter's name, because I actually said like, it's okay to mention, is it's an Igbo name. It's called Chizimuzondo. It means God, show me the path for life, right?
Wow. That's deep.
She took that child. The child has the most severe cerebral palsy. She's 18 now. She still doesn't have neck control, for
Wow.
example. And because of that child, she started a cerebral palsy center in Lagos. First, it was a small center in Surulere. Then after a while, it was first a day facility, then it became a boarding facility. And she's gone on to build this mighty purpose-built building in Lekki area, further inside that area,
Mm.
that caters for children with cerebral palsy. And the children she brings in are children who, of course, are from, those who can't even afford.
Oh,
Because
yeah.
caring for a child with cerebral palsy is not a work. It's not small money.
Mm.
These are children that still wear diapers at 18.
Yes.
Children that have
Yeah.
a myriad of physical health conditions, epilepsy, children that have stomachs because they can't feed. They have to use, they have to use NG tube.
tube,
It's
yeah.
it's so
Full on.
cost intensive. So she takes in children from those kind of homes. And not only that, the parents, she employs them in the facility. So those who don't have jobs, so they can take care of other children, take care of your child, take care of other children, and we pay you.
Wow.
So that is someone who life dealt limes, and she made what?
Lemonade.
Lemonade.
Mm.
So not only is she, so because of that child, she's helping so many other
many others.
children.
How does she get funding?
For me, people like me and you.
Okay.
And yeah, and the funding has been consistent over time because what she's doing is
Amazing.
it's amazing, honestly. And I'm glad that my path crossed her path because she's such a shining example of what you can do in a situation like that. For example,
Not every hero wears a cape.
she's amazing, and it's just the beauty of the community in Nigeria. For
Yeah.
example, you're not by yourself.
Yeah.
I think things like that are easier in that a society like Nigeria, where initially you have the community around you,
Yeah.
you have the support. First, you start with family, then you ask for funds, and that humanity. We're humane people. We know that humanity, is not lost.
Yeah.
So she got the support, and she's still there, thriving and doing what she's doing.
Oh, amazing.
Right.
What's the name of her foundation?
It's called the Cerebral Palsy Center.
Oh,
That's what it's called. I'm
wow,
sure.
that's amazing.
We'll
Yeah.
pin it to the episode because I think what she's doing is just amazing.
Oh yes, oh yes. Oh, like
Yeah. Thank you for
she's an
sharing that.
amazing.
Oh, that's amazing. I'm actually blown away that people still have that heart, and I know a lot of times when we think about Nigeria, we only think about the negatives.
Negative, yeah.
But the truth is there are still individuals like this woman, and I'm sure she's not alone. So people, please check out her foundation and support her. It started from a small one child, and now she's supporting loads of families. Wow. I'm actually speechless because
that's an amazing,
I can't even
honestly.
think if I can do that. I'm completely blown away by that story.
That's an amazing story.
And the way she takes care of that child.
I mean, you have
the
to
way
be
she
absolutely
loves-
selfless.
Oh, it's amazing.
You have to be absolutely selfless because that becomes everything.
It does.
Wow.
And
As it's hard enough when it's your biological child, but to do that for a child that is, you've adopted and they've told you give the child back and for you to say no, that's mind blowing.
remember how we started this podcast
Mm,
today?
exactly.
Nothing
keep
happens.
going back
We keep going back to it, and nothing happens by mistake. Why
No.
did that child go
To her, exactly.
Why was she the one that got that child?
Yeah.
So when you're in that kind of situation, instead of you to hit your head on the wall and say, why me, why me, why me? Look at what she's done.
Yeah.
So is that absolute faith in the Almighty Father? Like whatever situation you are in, if you look up to Him, you will find help.
There's a way out.
But if you're there hitting your head on the wall saying, why me? It should happen to me, life no balance, life is not fair, then you're stuck.
Yeah.
So
That really puts things into perspective. It really does. It really
I think that's
does.
my new slogan. If anything, that's what I'm going to take out of this episode. Everything happens for a reason, and I need to find the positive in it.
Yeah.
That's amazing. Okay, so I'm going to ask this question. Is there, because you talk about awareness, is there something like over awareness? Because now I feel like it's funny. I was like, at least there was a skit or something on Instagram, and it was a joke. The guy said he's lived through the ADHD pandemic of 2024. Basically, everybody now has
Everyone now
ADHD.
diagnosis, yeah.
And so, exactly. So, the question is there a thing, or is it just something in my mind? I feel like everyone, is there over awareness? Is that a thing?
It's not only in your mind,
Oh,
it's
okay.
also in my mind.
Okay.
Because much awareness comes with problems.
That's true.
And we're now looking for what is not there because we read it somewhere, or there's one TikTok group that showed somebody that's, now everybody say what's that word, motivational speaker. Now
Mm.
An
everybody's
expert.
everybody's an expert in short, psychiatry is the most abused field. Everybody's an expert in psychiatry on social media. Everybody has something to say. So that over awareness makes people think, oh, the smallest thing, oh, I have OCD, oh, I have ADHD. So, like I said, that's why we're guided strictly by diagnostic manuals.
Mm.
Before you say someone has a disorder, the person must meet
Most definitely, yeah. Yeah.
certain criteria, right? Before, but people use these things loosely. There's nothing we can do about it. Some people have tried to self-diagnose with something, but it's a self-diagnosis until you've been given until you've done a formal assessment and you've and you've been given a diagnosis. You don't have it, and if you've seen a professional, then you won't be given a diagnosis which is in yours.
Yes.
So over awareness is also a problem, really, and it makes people also fight with with the professionals.
Yes.
Because sometimes, I've been in situations where I've felt, oh, this person doesn't meet the criteria, and I've had
And they are
people
showing their minds that
fight
they are.
me
Mm.
because they've gone to Dr. Google. Dr. Google is, of course, has more experience than I have. Who am I when Google is there? So I've checked Google, and Google says I have this problem, so you must give it to me. But so that's the problem with too much awareness. People are now seeking labels, and particularly when there's a secondary gain, it becomes
Yeah.
more difficult.
Yes,
You know that if
absolutely.
you have a label, you get certain things.
Yeah.
So people are
Yeah,
now
yeah.
seeking labels.
Yeah.
So
Yeah.
everything has, pros and cons,
Yeah.
largely.
Thank you for that. But I think one of the questions, I'm linking it back to a lot of what I'm finding is that there are lots of, I don't know about um should I say Caucasians? I'm talking more sort of our generation where people are getting diagnoses in adulthood.
Mm.
And I think we talked about this earlier where there were people that were presenting with certain behaviors or had behavioral issues that there was no name
Mm.
for it. Um, I think there's also the saying about girls being very good at masking
Mm-hmm.
their
Mm-hmm.
symptoms
Mm-hmm.
until quite later in life.
Mm-hmm.
So I think it's going back, sort of finding a way to round up what we're talking about. It's about advice because now that there's a lot more awareness, I know we talked just now about over awareness, but also there's also that because it's difficult to go through a whole lifetime of feeling different and now now finding that as an adult it's harder because as a child you still have, should I say, that cushion,
Scaffolding,
you
yeah.
know, of your parents or peers or whatever, support maybe in school, because there are some children that don't have diagnosis, but they are on the send register
Mm-hmm.
because they know that something is
It's
wrong,
different, yeah.
But then I suppose the question in a way is also for you to give advice. Why is it important that if there's something wrong, because I think that's the issue that, or the thing that we are finding, is that people really struggle with seeking support for their children, even when there's an obvious problem. How, if they don't get that diagnosis as a child, how can it then go on to affect them in adulthood?
Mm.
Because I think it's really a thing where a lot of people are getting their diagnosis now as adults because things were missed for them as children.
Mm.
Yeah, because their parents didn't take the
Yeah.
relevant
Yeah, and I've touched on what the consequences can be of it,
Yes.
because their lives have been affected so significantly.
Mm,
They didn't get a diagnosis, then they go through school, they don't get the best of grades because they didn't do as well as their peers.
Mm.
Then they get jobs and they're struggling, or probably they go to learn an apprenticeship that doesn't need that amount of mental effort,
Mm.
and even on the job, they're struggling. You know, then they go into marriages are breaking down, or they get in trouble with the law, issues with driving. And that's the beauty is that these days there's a really high awareness of the fact that ADHD is there. So a lot of people are getting ADHD diagnosis in adulthood. The
Mm.
NHS waiting list is the figure, I'm not sure, I don't recall, but it's alarming if you hear the number of people on the waiting
I
list
can
for.
tell you for children, you would know this obviously, but We have children that are on the waiting list for 4 years, five
Oh
years,
yes, oh yes.
waiting
Five
to yeah, yeah,
years.
yeah,
Yes, it depends
yeah. Depends on the
on the
yeah.
service and the area. But even adult ADHD waiting list is long because people are now able to look retrospectively and say, "Oh, wait a minute, this is what the problem was," and
Mm,
nobody was quite sure what was wrong with me. Nobody knew why I was different. Nobody knew why I was going through all these difficulties. Now they are seeking the help, and life has happened. They cannot do what has been done, but it puts things in perspective for them. Like, okay,
Mm,
this is what the problem was. I
yeah.
wasn't going cuckoo.
I'm not
You
mad.
know?
I'm
Exactly.
not mad.
And I think for me, my final question and what I'll use to round up is, and I think it's something that I think is my one of my theories for why we're so resistant to getting the help or getting the label is because we feel like we've done something to cause it,
Mm,
and or that it's something that we could have prevented.
mm,
So is that, let's dispel that myth, I think. So is there a cause for ADHD or autism that a parent could have, or is there something that a parent could have done
Mm.
differently for
Maybe they
their
didn't eat
child
right
not to
during
have had
pregnancy.
ADHD or autism?
Could it be a spiritual problem as well? I think that's yeah.
But everything in psychiatry, everything is biopsychosocial. So in terms of etiology, in terms of causes, it's a mixture of things. With ADHD, for example, it's a combination of the gene and the environment. So is there anything parents could have done right? For example, smoking in pregnancy can lead to ADHD. So if you're a smoker in pregnancy, don't be smoking now because your child could, there's a high potential your child having. So there's some things that can be controlled. Some things can be controlled.
Mhm.
Genetic inheritance can be controlled. So the gene and the environment work hand in hand. Sometimes these environmental factors turn on these genes that are there predominantly. So in some cases, some things are being controlled, but with ADHD, a lot of things can be controlled.
Mm,
So it's that awareness, and people think it's bad parenting.
Mhm.
People blame themselves when their child has ADHD, and that's why they don't seek help because
Yeah.
they think, oh, it's something that they've done wrong.
Yes.
So it's that awareness to know that no, it's not anything you've done wrong. Especially if you've done everything right. But if you're spoken in pregnancy and things like that, it can predispose the child to having ADHD.
Mm.
So that's those are the behavioral, the environmental things that can be changed. But then again, if a child has ADHD, there is help. In fact, that's it. The stimulant medication is that medication that works. What's the word? How do I put it? It works absolutely well. If a child has ADHD and start the child on stimulants, the difference is noted almost immediately.
Wow.
wow.
Yes. So
Wow.
so instead of blaming, because when a child has a problem with same too, most parents tend to internalize it and feel as if they
That
did
you're a
something wrong,
failure.
feel like they're a failure, and then it stops them from getting help for that child.
Mm.
So just having that, even if you did something wrong, it has happened already. Even if you smoked in pregnancy, it's happened already.
Mhm.
But just take the child to seek help. So, just to fix the damage on time or to sort out the problem as early as possible.
Do you know where we can go for the next hour? Honestly, so many wonderful nuggets that you've dropped. We're so grateful. Thank you so much.
Thank you
Thank you
too.
so much for coming on the
Thank
podcast.
you. And I think we're going to have to get you back because I think there's so much we still need to unpack on this topic. So we'll
I'll think about it.
Yeah, please don't charge us yet.
When should I start
Don't
charging?
charge. No, don't worry. I don't think that time will ever come. Don't worry. But
but
yeah, we
it's
really appreciate your time. We really appreciate your time because I know that your time is money. So I'm very grateful that you've made the time for us.
It's fine.
I
It's my
really
pleasure.
appreciate it.
thank you so much.
Thank you.
I hope what our conversation today has at least brought some understanding because for me, it really has. I've taken away so many things from
Yep.
this conversation. It's changed my philosophy a little bit on how I'm approaching life in the sense that everything happens for a reason. There's
Yes.
no good or bad experiences. That's
Yep.
another nugget that has
Yep.
been dropped that I'm
Yep.
taking with me from this episode. And if you have a child who you suspect is neurodivergent, please seek help. Even if it's something you may have done, as you've said, you are where you are.
Yeah.
The support is required, and we back it up with prayer as well. There's still a
Yep.
place for prayer, there's still a place for your faith, but they have to work hand in hand together. Thank you so much. If you've enjoyed this episode, please don't forget to like, share, subscribe, and we'll see you on the next one.